see. Here we go. All right, we're going to start off by talking about the required vaccine for all three of these trips. Is this brand new information to anyone that there's a required vaccine? No, so we're all aware. Okay, so this vaccine is required for a number of vision trips. You guys are all going to very mosquito endemic areas, and yellow fever is one of the most fatal mosquito-borne illnesses. So that's the reason why Dr. Marquez, my boss, our medical director here at Southern, has made the decision to have this be required. It is not required by the countries that you're going to for entry. It is required by Southern due to liability reasons and because we want you all to return alive from your trips. Yellow fever is, like I said, a mosquito-borne illness. You get it from a mosquito bite, and we have a vaccine to protect against it. It's a one and done, and it protects you for your entire life. So anywhere else you may travel, you don't have to get this again if it is recommended or required for those areas. About 4 to 8% of people who contract yellow fever will die because of this illness. To put that in perspective, with COVID, it was like 0.1% to 1%, depending on your age and the country where you contracted COVID and where you received treatment. So this is significantly more fatal than COVID, and that's why we take it so seriously. It attacks your kidney, your liver, your organs, your brain, causes severe fever, and it also can attack your stomach, pardon me. Any questions on this in terms of a required vaccine? Anyone have any concerns about that? Common side effects from this vaccine include injection site tenderness, of course. You're nodding your head. Some people experience some really mild viral type symptoms like body aches, fatigue, kind of like a flu shot might make you feel a little under the weather for a day or two. In about 1 out of 100,000 injections, someone might experience some neurological side effects like Guillain-Barré syndrome or encephalopathy. But like I said, it's 1 in 100,000. Yellow fever prevalence, so I put a little blue arrow to all of the areas where you guys are going to be going in these 3 countries. Everywhere where there is yellow, there is endemic yellow fever. So that's why we're taking it so seriously. All right, moving on to talk about recommended vaccines. So this is hepatitis A. Hepatitis A is currently part of the standard childhood vaccine series in most states, not every state, but most states. So a lot of you guys have probably already had at least one, if not both, of these vaccines. They're given 6 to 12 months apart. So clearly, if you haven't had it, you don't have time to get both. But the good news is you have about 90% immunity from that first dose. Hepatitis A is actually quite easy to get if it is around you. The reason for that is it's spread by fecal-oral contamination. So dirty food, dirty water, contaminated water, juices, fresh fruits, vegetables, those kind of things that were handled or fertilized with less than stringent practices could result in someone getting this. It attacks the liver, it causes severe nausea, vomiting, diarrhea, or constipation, and can result in the need for hospitalization. Some people are sick with symptoms for up to 4 months after contracting this. It's definitely survivable. It's just a miserable thing to go through, so that's why it's on the recommended list. Any of you that might be medical majors as well who haven't had this vaccine may want to get it now just because a lot of med schools, grad schools, and hospitals require it for employment. Another one, typhoid. So typhoid, just like Hep A, is spread by fecal-oral contamination, contaminated food or water or juices, and this one's bacterial in nature. So it is manageable with antibiotics, but it is a hospitalizable illness as well due to the severity of symptoms. Typhoid used to kill a lot of people back before IV fluids and antibiotics. Has anyone ever heard of Typhoid Mary or the term Typhoid Mary? Some of the older folks are shaking their head. So Typhoid Mary was a woman who lived way back in the day, and she was an asymptomatic carrier, meaning she had typhoid, but she had no symptoms from it. And the sanitation systems back in her time were not very robust, so she unfortunately contaminated her local water system and Much of her town died because of it until they figured out that it was her, and they were able to separate her and her waste from everyone else. Hepatitis B. Now, most of you who had your standard childhood vaccines will have had a series of 3 hepatitis B. This is actually the first vaccine given after birth for most individuals. Hepatitis B is not as easy to contract as typhoid and hepatitis A. It is a blood-borne pathogen, so people will get it from a dirty needle stick, tattoos. It can be sexually transmitted, passed from mother to baby. So again, less easy to get. And it's a 3-dose series. It's given over the course of 6 months, but this is a chronic illness that once contracted is always an issue, and it attacks the liver. Now, tetanus. This is one that we get every 7 to 10 years. Those of us in the medical field, closer to every 5 to 7. So it covers for 3 different bacterial infections: tetanus, diphtheria, and pertussis. I have a depiction here of tetanus for you. Tetanus is also known as lockjaw. It is also known as kind of like the dirty or rusty nail disease. It has nothing to do with nails, and it has nothing to do with rust. It has everything to do with dirt. So anywhere dirt is present, which is arguably everywhere, there's the potential for tetanus to be introduced into a wound, even a tiny little wound like an abrasion. If a person is not adequately vaccinated for tetanus and they are exposed to tetanus, they can develop neurological symptoms like this, where the muscles spasm to the point that bones break, the diaphragm doesn't work, you can't breathe, your throat doesn't work, you can't swallow. It's arguably survivable, but it requires significant hospitalization, a lot of muscle relaxants, and to be hooked up to a whole bunch of machines to keep your body working until the infection is under control. Like I said, it also covers against diphtheria and pertussis. Those are 2 respiratory illnesses that are also potentially fatal. Fortunately, they're very rarely ever seen because of vaccination. Most people get this series of 4 or 5 in early childhood. They get it again around 7th grade, and since they need it every 10 years, usually students in the college age group are getting to be right about due for it because they had it when they were 11 or 12, and now you need it again around the age of 21, 22. All right, so rabies. Rabies sounds like a really exotic vaccine. I remember when I first started talking about it, I was like, gosh, does anyone ever get it unless they've been attacked by a raccoon? I don't know. It's actually super common. People who work in veterinary medicine get it all the time and have to get boosters every 3 years or so. The rabies vaccine is a series of 2 doses given 1 week apart, and what any vaccine, in particular the rabies vaccine, will do if injected into your body is it will create immune memory in your body. So your body will recognize the rabies virus as a bad thing that it needs to attack. That way, if you are potentially exposed, if you have some sort of encounter with a potentially rabid critter, you're scratched or you're bit, your body then has that immune memory circulating through your blood, and it will immediately start to attack that rabies virus. If you have that, you still need additional rabies vaccine to make sure your immune system is responding robustly to this virus. And you need to care for the wound, because often wounds caused by animals get infected pretty quickly. If you have a similar encounter but you haven't had the rabies vaccine, you need the vaccine, you need care for the wound, but you need that immunoglobulin that you don't already have circulating in your bloodstream. You need it given to you via medical personnel. It's injected into and around the wound site to contain the virus so that the virus doesn't go from exposure to active infection. Active infection of rabies is fatal, period. There's no treatment, there's no coming back from it. Now, there is moderate to severe risk for these trips from stray dogs that live on the streets, as well as other wild animals. This is one of the only times where I would really caution you against trying to help pet feed or provide care for an animal in need. If you've not had the rabies vaccine, it's a big risk. That immunoglobulin that I talked about, if you're getting it provided to you in the form of an injection, it's expensive, which makes it harder to find. Some people in need would either go without, or they would have to travel to a larger city or a bigger hospital in order to be able to receive it, which of course takes time and money and diverts you away from your goal, which is mission work. The MMR vaccine, again, if you've had your standard childhood vaccines, you've had these. It's a series of 2. Uganda is currently experiencing a measles outbreak. So the students going to Uganda might want to make sure that you have proof of 2 MMR from childhood. And then of course your varicella or your chickenpox vaccine. If you haven't had chickenpox and you haven't had the vaccine, I encourage you to think about getting the vaccine. Getting chickenpox as an adult is no small feat. Adults get much sicker from chickenpox than small children do. Any questions about that? I know the rabies one's kind of complicated. Yeah.
Stop listening for just half a second. How often does the rabies vaccine need to have a booster?
Every 3 years. Yeah. Any other questions? Yeah.
Are these recommended vaccines available on the UHC or through you guys?
Yeah, they're available through us. So we don't carry the rabies vaccine. We carry the other vaccines, not the yellow fever. Yellow fever, you guys are going to go en masse down to Dr. Moody's office at Chattanooga Family Practice to have that administered, because you have to have a special seal and stamp and all this fancy stuff to give that vaccine. In general, if you have the school's health insurance, like the school's student health insurance, it's free to you to get these vaccines through the health center. If you do not, if you have insurance through your family, through work, or anything like that, that's fine. It's typically cheapest for you to have me send the vaccines as a prescription to your preferred pharmacy, and the pharmacist there administers them for whatever your insurance copay would be, often free or at a significantly reduced cost. Any other questions?
We will be paying for the yellow fever vaccine. It's $205 at our discount, so it's not a cheap vaccine, but we are covering that for you. So any of the recommended vaccines would be what you're talking about. Yeah.
Was there another question? Yeah.
If we already have the yellow fever vaccine, do we have to fill out any of this paperwork about like getting it or anything like that, or can we just do it?
You would just need to show us your form, like the proof of your vaccine. Any other questions?
How many not wellness visits, we're talking travel consults, can you see a day? And we've got 3 weeks before April 21, so we've got 5 business days that they're open.
Mm-hmm.
We send a list of your names. You can't get on the bus unless we know that you have been there. We want to make sure that you know all of the recommendations and everything. So talk to us about that.
Yeah, so these visits, the more you're able to retain from this talk, the faster that visit goes. But I know you guys have a lot of information thrown at you today, so I understand, don't get me wrong. But we go through all of this stuff again, line item by line item, and we compare it to your vaccine information that has been provided to us already. Often students want to chat with mom or dad or something along those lines, so those things take time. We budget about 30 minutes for each and every single one of you to ask questions and to go through all of this information again so that everyone's on the same page and feels comfortable with the decisions that you're making, whether you accept or decline these recommended things. So, that being said, we're seeing all of you guys 30 minutes at a time, and then we also have everyone else, everyone who got hurt at intramurals, everyone who's sick, everyone who's coming in with mental health related issues. All of these things take up a lot of time. So, what we really, really don't want to happen is to have all of you try to come in 3 days before this is due. Is that fair? So, in an effort to not have these things feel rushed, please start calling me tomorrow morning, and I'll have all of our information up there. Call or email tomorrow morning. We see roughly 1 to 2 in each morning half and 1 to 2 in each afternoon half of our day, and there's 2 providers who are doing this. So at the most, we can see 8 of you a day. We prefer to do 4, that way we have enough time for all the walk-ins and all of the other scheduled visits. So just keep that in mind, and we tend to not do them on Fridays because Fridays are their own special kind of crazy. So just keep that in mind. We mostly do these Monday through Thursday, between 8 and 5 p.m., and we take a lunch from 12 to 1. Any questions about that? Okay. All right, mosquito-borne illnesses. So malaria, dengue, Zika, and chikungunya. Out of this list, the only one that we can protect you from in advance is malaria. This is not done with a vaccine, to clarify. I know this is kind of confusing. We're moving on from talking about vaccines now to talking about medications and other forms of prevention. So malaria, we are able to prevent with a once-a-day pill. It's called Malarone or atovaquone proguanil, if you like the generic name. It's given once a day, starting 1 to 2 days prior to your departure time, and then daily for the duration of your time in country, and for an additional 7 days after you come back. That additional 7 days is actually really important, because if you were to get bit the day that you're leaving, and then you immediately stop your malaria preventative, you could contract malaria a couple days into already being back here on campus. Dengue, chikungunya, and Zika, you can see the symptoms up here. They're all kind of viral-like symptoms: body aches, joint pain, headache, stomach ache, those kind of things. But if you kind of compare all of these closely, you'll notice one main thing is missing, and that's respiratory symptoms. No one has congestion and sore throat and cough because of these. It's going to be more body aches, headache, those kind of symptoms. Now, if at any point you develop a fever while you're in country or in the 7 to 10 days after you come back from one of these trips, please seek care. Don't write it off as, oh, I just got sick, because it has the potential to be something more than that, and we'd like the opportunity to see you and evaluate you for that so we can make sure we know what's actually going on. Yeah?
Yeah, how does the malaria medication specifically counteract the mosquito bite?
Yeah, so it's the same medicine that's given for treatment. It attacks the malaria pathogen. So if you already have it in your body, when the malaria is injected into your body via the mosquito, it kills it before it has a chance to spread. Kind of like if you were taking amoxicillin and you were exposed to strep, you probably wouldn't ever get strep symptoms because you already had that antibiotic in your system. Any other questions? Yeah.
I'm sorry, in the checklist it says malaria medicine. Is there anything specifically recommend for entire?
I'm sorry, I can't hear you.
In the checklist it says malaria medicine I should take. Is there like a specific one you recommend I should buy?
So the malaria medicine is a prescription.
Yeah.
Yeah, so the one that we recommend is Malarone. There are other options. We found Malarone is the most well tolerated with the least amount of side effects. If for any reason someone does not want Malarone, then there are other options, but we have to talk about the cost benefit. For example, doxycycline is another option for a lot of these destinations, but doxycycline can cause significant, what we call photosensitivity, meaning sensitivity to sunlight. So someone who might be able to go without sunscreen and be outside for an hour or two and not have any problems might burn severely in an hour of direct sunlight, which in all of these locations could be a problem because you guys are probably going to be under a lot of sunlight in these locations. So just kind of cost benefit when we talk about those things. Did you have a question? Oh, okay. You're just sitting, okay. Just making sure. Okay, that's all right. All right, so when it comes to the dengue, chikungunya, and Zika, we want you to prevent these illnesses by reducing the likelihood that you're going to get bit. So, of course, long sleeves, long pants, loose-fitting clothing, light-colored clothing are going to make mosquitoes a little less likely to want to bite you, or a little less likely to be able to bite you. This yellow bottle here, permethrin, this stuff is so cool, guys. It is an amazing chemical. It's very safe. And the cool thing is you don't have to put it on your skin. You put it on the outside of your daytime clothing. So you can get this from Walmart, Amazon, the outdoorsy stores, anything like that. And you would take your daytime clothing, your shoes, not undergarments, not pajamas. You just lay out all of your daytime clothing and generously spray with that spray bottle. Wait for it to dry a couple minutes, flip it over and spray again. That permethrin will stay on your clothes for 60 days, roughly, through laundry cycles. And it will repel you and make you smell really bad to mosquitoes and ticks, actually, which is a pretty cool thing. So it can be quite useful even here in Tennessee. Then this Repel, really any brand of mosquito repellent that you guys like is great. I like the Repel brand because they make a stick version. It's kind of like a big glue stick, so it travels super well. You don't have to worry about the liquids, gels, or aerosols, airplane rules, or worry about it leaking in your check bag. Any questions about that? All right. So malaria prevalence. Because malaria is endemic in all of the areas, again, same idea of yellow fever. There's lots of mosquitoes where you guys are going, so there's lots of mosquito-borne illnesses. Because of that, we are requiring a malaria medication for each and every one of you because we don't want you to come back with malaria. Is that fair? Yeah? All right. The malaria medicine is not particularly expensive, especially since you guys are getting a fairly small quantity of it. The long-termers who go for 10 months, that's a couple $100 for malaria meds for that long of a time, but you guys aren't going that long, so it's well worth the financial investment to avoid getting malaria. Has anyone ever had malaria here? Is it fun to have?
I've had it 3 times. It's not fun.
Yeah, I imagine. One of my friends actually got it, and she had lasting neurological side effects like impaired short-term memory for about 3 years after she had malaria. So it's not just you're sick for a little while and then you're better. Yeah?
I have permanent ringing in my ears because I had to use quinine.
Mm-hmm.
So I have permanent ringing in my ears.
Mm-hmm. So what he's saying is one of the treatments is quinine, and one of the side effects of that medication can be what we call tinnitus, or ringing in your ears, which of course affects your ability to hear people talking and can really drive you crazy if it's too loud. So yes, malaria can have lasting side effects. The treatments can have lasting side effects. So prevention is key. All right, traveler's diarrhea. I'm sure probably some of you have had this. In the States, we call this food poisoning. In Mexico, it's Montezuma's revenge. In general, it's a spectrum of severity of E. coli, Salmonella, Shigella, that kind of thing. It's a foodborne bacterial pathogen. So some people might contract this and have loose stools 3 or 4 times a day, kind of feel queasy, but be functional. Other people might not leave the bathroom for a few days. We don't want that to be you. So in addition to being careful about what you're eating, and we'll go over that on the next slide, we want you to take a medication with you, assuming you're not allergic to it. The medicine is called azithromycin. It is a prescription. You can't buy this over the counter. And you would take this antibiotic, which will kill the pathogenic bacteria. You want to take it at the first sign that this is not an okay stomach situation. Some people say, well, how do I know? You know. You'll figure it out really fast. You don't have to wait until you've been sick 2 days, 3 days. You know, this isn't like, oh, I have a cold, I don't need to rush right into the doctor. No. This is, you have some loose, watery stools and you don't feel good, you start taking it. It's 1 pill a day for 3 days. So easy peasy, and it will make it so that you have a much more pleasant trip. Yeah? Azithromycin. The other medicine that we recommend to go along with this, which is a prescription, is a medicine called Zofran. Some of you probably had this before. It's one of my favorite medicines ever. It's a dissolvable tablet that's placed under the tongue. It dissolves there and is absorbed into the bloodstream, and it stops nausea and vomiting, which is often an issue as well with traveler's diarrhea. So we want you guys to be able to hydrate yourself and not just immediately throw something up when you take it, including the antibiotic. But we want you to be functional and get back on your feet as fast as possible. So what's safe and what's not? This picture is pretty self-explanatory. Yeah?
Do you recommend taking both of those medicines, or was it one or the other?
Both.
What was the second one?
Zofran. Yeah, it is not over the counter. No, it's a prescription. So like I said, these are prescription medicines that we have at the health center, and we can also do as prescriptions to your preferred pharmacy. All right, so like I said, this is pretty self-explanatory. You guys can look at it, read it. If you want a copy of it, I have copies at the health center that I can give to you. In general, anything that is factory prepared, comes in a can, comes in a bottle, is heated to the point of steaming, or that you can clean the outside of yourself, for example, like a banana or an orange, that's going to be safer than, say, berries or a salad or anything that's not cooked to the point of steaming and cooked all the way through. Anything with ice, anything, frankly, anything fresh is going to have some level of risk associated with it. Any questions? Yeah.
I don't know if you agree, but I would consider in certain places that we're going, we would not take any hot beverage prepared locally.
Yeah, that's true. Like any hot coffee or tea, something like that would probably be somewhat risky as well. What about charcoal? I know we love charcoal. Charcoal is so good at what it does. Charcoal is so good at what it does, I actually don't want you to take it. Go figure, right? Okay, let me explain. Charcoal will bind with prescription medications. It will even bind with some supplements. But if you get sick to your stomach and you think, I'm going to take some charcoal, see if that does it, well, there goes your malaria medicine for the day. If you're taking charcoal multiple times throughout the day, multiple days in a row, and you're taking your malaria med is significantly less effective now because of how good charcoal is at binding with things and inactivating them. Same goes for if you have an upset stomach, you think you have traveler's diarrhea, so you take a handful of charcoal and your antibiotic at the same time. That was pointless. Don't do that. Like I said, charcoal is so good at what it does. If you want to use it topically, if you get a bug bite, if you get something like that, that is great, but please do not take it orally on this trip because it will render your prescription medicines, which are significantly more effective at treating the conditions that you'll actually be encountering on these trips, it'll just bind with them and render them inactive. Any questions about that? All right. Your pre-travel visit, we kind of touched on this throughout the visit, throughout the talk rather. We'll go over your immunizations, we'll compare your childhood and most recent immunizations to the ones that are required or recommended, and we will supplement as you are comfortable with and as is required for the trip. And then you can leave with the medication prescriptions for your malaria, for your traveler's diarrhea, for nausea. If you're someone who has asthma or any other condition where you need access to certain medications, we'll make sure you're not running out in the near future so that you can have enough to get you through your trip safely without running out. Now, we don't go over all of this just to make you guys scared. We know that God is going with you. He is blessing these trips. We go over this because we want to make sure that we have also done our part to make sure that you are abundantly prepared and that you can come back and immediately return back to whatever it is you have going on for the rest of the summer, and that you will do so healthy and happy and with wonderful stories to tell, not horrible stories of staring at the bathroom wall for 4 days. All right. Thank you guys for your attention. I really appreciate it. This has been a really great group. I really appreciate your attention. Thank you.